Hi, I'm Ange from Hospo Health. I want to talk to you about mental safety in the workplace. So the most fundamental thing to focus on is ensuring that your job and your workplace are as mentally safe as possible. In the same way that you do this for physical safety, injuries and accidents can be prevented with a strong safety culture and adequate assessment and control of risks. So too can psychological injuries. These are types of harm caused to our mental health that could result in the diagnosis of a mental health condition or the worsening of an existing condition. When you think about work-related harm to mental health, you probably think about work that exposes people to potentially traumatic events like emergency services and healthcare. But harm to mental health can be something that happens in any industry, as over long periods of time, prolonged exposure to high levels of work-related stress can affect both our mental and physical health through wear and tear, if you like. This has been recognised as an occupational syndrome known as burnout. So what are the most common sources of work-related stress? What are psychosocial hazards in the workplace? There's good research evidence for quite a wide range of factors. Safe Work Australia has 14 factors to consider. These are job demands, low job control, poor support, lack of role clarity, poor organisational change management, inadequate reward and recognition, poor justice or fairness in the organisation, traumatic events or material, remote or isolated work, poor physical environment, violence, aggression, bullying, harassment, including sexual harassment, and conflict or poor workplace relationships and interactions. In some roles, all of these factors may be present, and in others, only a couple are common problems. It's important to know that they interact with each other too. So for example, bullying is more prominent in organisations with high job demands, poor fairness procedures, for example. You can read more about this on the Safe Work Australia website using the following link. In addition to these factors, conditions of employment are also important. What's known as precarious work, which could be casual or short-term contracts or self-employment, jobs that don't have access to any paid leave or benefits, for example, is associated with increased risk of depression and anxiety. So these are important factors to be aware of and to manage and control.